An Ontario woman is sharing her story after a stressful and overwhelming experience at a Newmarket hospital. She says she's absolutely shocked by what she saw happen, and her heart breaks for our frontline healthcare workers.
It's not what I expected. I hadn't realized it was to that point.
27-year-old Kelly Anderson lives in Georgina, north of Newmarket. On Monday, September 6th, she says she was experiencing a great deal of abdominal pain, so she went to South Lake Regional Health Center. After getting some pain medication and IV fluids, Anderson was sent home after 12 hours. The next day, she felt worse and went back.
I ended up spending most of that time right up next to the nurses' station in a bed.
Anderson was admitted to the hospital and says for the majority of the 3 days she was there, she was lying in a bed in a hallway as medical staff tried to figure out what was wrong with her.
It was hard to sometimes get their attention just because there was so much going on. They were so sweet and so kind, but it broke my heart to watch how much they were having to do with the little amount of people that they had.
At times, the experience was humiliating.
Anybody who's done a colonoscopy prep before knows it's not fun. So it's drinking a lot of liquids that are trying to clean out your system before you go in for that procedure. You are exposed in a hallway. There's police officers walking by, there's patients walking by, there's millions of people walking by, and you're just exposed there going through this.
We reached out to the hospital for a comment, and while they couldn't say anything about Anderson's case due to privacy concerns, here's what they did say. In part, the negative impact of hallway healthcare on patients can be significant. The communities served by South Lake are amongst the fastest growing and fastest aging in Ontario, and in recent years, South Lake has become one of the most overcrowded hospitals in the province. The hospital has not had any significant acute care capital expansion since 2003. We have been transparent about the capacity issues South Lake faces. Despite these infrastructure challenges, South Lake's dedicated staff and physicians provide our communities with leading-edge care each and every day. Dr. Prasada says while majority of hospitals are okay in Ontario, he is nervous.
The system is working right up to the bone right now. It's always been like that. I understand that, there's been some incidences where people have been in hallways, but this is not a new problem in our hospitals. We're always at 99, 100%, even 110% capacity, even before COVID. And you don't want to test this system. You don't want to overwhelm it by overwhelming it with cases.
Anderson says she's thankful to the wonderful frontline health workers who did their best to take care of her.
I never spent much time thinking about what it was actually like right now in the hospitals, and that was naive of me. But it now crosses my mind every single day, and I'm sad and I'm heartbroken about it.
Anderson says she is doing much better now and isn't in any more pain. As for how we could keep capacity at a manageable level at majority of Ontario hospitals, Dr. Prasada says we need to keep a close eye on schools and make sure they are a major source for COVID cases.